Hi. Hi, I'm Dr. Mo. It's nice to meet you. Are you nervous? It's okay. Surgery's a big deal. You're allowed to be nervous. It's very normal, okay? That's totally fine. So, I'm going to just take a quick listen to your heart and your lungs, and I'm going to make you do a lung exercise, and I'll explain some of the procedures, and we'll get going, okay? That's totally fine. It's okay. Okay, let me take a listen to you. Nice deep breaths in. Good. Again. Good. Again. Again. Good. Alright, I'm going to listen to your heart for a second. Alright. Wonderful. Wonderful. Everything looks pretty good. Set that over here. Alright. The next thing I'm going to have you do is this little toy, so to speak. You've been doing it with the nurses. Fantastic. So you know. Okay. Well, I just kind of have it dialed in here. We've been practicing it already. I'm going to push it up a little bit. Yeah, a little up for a challenge. So remember though, when you're breathing in on this IS, you're really looking over here at these two arrows, right? Arrow right here. And we want you to focus on getting this blue dot plastic piece to float in the center of these two arrows. Okay, we're going to be looking over here because that gives us a, quantifiable number for how well you're doing right here. But this is your goal, so we really want you to focus on doing this part really well, okay? Okay, you ready? Let's see how you do. 1, 2, breathe in, good. Good, breathe. Good. It's okay, yep, that's wonderful. We're going to do this a couple times, okay? Breathe. Good. Okay. Again. Second. Suck. Good. Alright, one more time. Second. Good job. Good job. So we're up here. Alright, so we do this because we want to measure. Anytime you have surgery, you're going to be laying in bed for a little bit. Your body's trying to recover. So you've got, these little breathing sacs in your lungs called alveoli. And if you don't use them, you lose them. So we're trying to pop open as many as we can right now by doing this. And we're also trying to get a number for pre and post surgery. And we'll try to get you back to here post-surgery, but it's gonna hurt, okay? Anytime we have surgery on your core, you're using these muscles that you use to breathe, so it's gonna be painful, all right? Which is why we really do need to make sure that your pain is managed as well. Okay, so all of these things are important. Alright, let me just verify. So you've never been in surgery before, is that correct? Okay. Any allergies to any medications that you know of? No? Okay. Alright, we are going to have to intubate you for this procedure. That just means that we're going to be putting a tube down your throat, and we're going to be hooking you up to a ventilator. the anesthesia I'm going to be giving you is going to knock you out, right? You don't want to be awake for surgeries. So we're going to be managing your breathing on a ventilator for the procedure. We'll take you off as soon as we deem that you're ready for it. Okay, most of the time it happens in the surgery itself. By the time we wheel you out the door, tubes out, everything's gone. But in likelihood that, in the unlikelihood that we would need to keep it in there, we'll do that for a little longer, okay? So you might have a sore throat on top of all the soreness that you're going to experience from your heart surgery. Okay? Okay, do you have any questions for me? Not yet, you're just nervous. That's okay. It's okay to be nervous. Alright, you sit tight here, and I'm going to gown up and wash up and get sterile. Okay. Okay. Are you ready? Okay, so I'm gonna have the optimal machine here. Beautiful, beautiful. Heart rate's up here. Saturation and your blood pressure, all things that we're going to be monitoring. Your CO2 levels, temperature, we've got it all up there. Okay, so I'm going to start the anesthesia. Alright, got your IV here, we flushed it. Okay, IV is flushed and we know it's patent, we're ready to go. Are you ready? No problem. Okay, so I'm going to have you too, so I'm going to have you start to count down from 10. Okay. So, you ready? Okay, push. Okay, 10, 9, 8, 5, 4, and he's out. Alright. Alright guys, let's make this a good surgery, okay? Okay. Good night. Hello. Wake up, sleepyhead. Hi. No, you're in the hospital. Do you remember which hospital? Do you remember why you're here? Okay. Can you tell me what year it is? Who's the President of the United States? Wonderful, wonderful. Okay. I'm going to have you lift both your arms off the bed. Hold them out just like this. Okay. Alright, and push down against my hands. Good. And push up against my hands. Good. Okay. Just doing a quick assessment. How do you feel? Yeah. Yeah. It's going to be very sore. We need to make sure we're on top of your pain medication, okay? The nurses are going to be coming in and they're going to be asking you around the clock, what's your pain like? Okay, because we want to get you up off your feet, onto your feet as soon as possible. Okay, so we're going to manage some drips right now. Your blood pressure is a little soft, so we've got you on a pressor that just is going to help manage your blood pressure. You're getting fluids. The surgery went really well, okay? Nothing, no ugly surprises in there. We were able to, just open you up, and you should have really good cardiac output from here on out, okay? So all really good things. So now, moving forward, they're going to bring in a TV and have you watch some at-home regimen care for your heart, all right? We're going to manage your blood pressure, your pain med, everything. All right, we're going to be using this. Do you remember? Remember this. This is going to be one of your best friends every hour, 10 times on the hour. You're going to be using this, all right? And yeah, you're going to have times where you're in a little bit more pain. It hurts a little bit more to take a deep breath in, and that's okay. But the next hour, try to make sure your pain is being managed so you can take those big breaths. All right, we want you out of here breathing as well as we can, okay? Oh. No, just one of the inside is coming off of this mask. I'm like eating the cotton or whatever it is. The fibers. I'm going to take another listen to you. Make sure I'm hearing all good noises in there. Alright, take a nice deep breath in. Good. 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 Heart rate. Alright. Alright, we did a EKG already. Everything looks good from that point of view. So EKG is good. Everything, it sounds really well, sounds clear. You're moving air really well. Do you have any questions for me? Okay, I'm gonna let you sleep then. Congratulations on a very successful surgery. We'll get you home in a couple days and out of here, alright? Congratulations. It was so nice to meet you. It was a pleasure. Thank you.